सुखिनः सर्वे सन्तु निरामयाः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत्।
Hello, viewers. Today, on the eve of World Health Day, let's begin with this prayer. Sarve bhavantu sukhina, sarve santu niramaya. True wealth of holistic health and happiness for all. Truwellth Integrative Health Centers were established with the mission to reverse, control, and prevent diseases and augment health by integrating all appropriate scientific evidence based personalized nutrition and fitness therapies, functional medicine, and advanced surgical treatments with a holistic wellness approach. This also coincides with our Prime Minister's vision of the flagship Ayushman Bharat Health and Wellness Centers initiative. Aligned with this year's World Health Day theme, Together for Health, Stand with Science, Truwellth brings together a distinguished panel of leading experts across specialties to move beyond fragmented care and discuss what is driving the rising burden of modern diseases today. Are we treating the symptoms or addressing root causes? And most importantly, how can we integrate science of medicine, advanced surgeries, nutrition, and lifestyle management to create sustainable long-term health outcomes? Because the real question is not just how to treat a disease, but how to build a sustainable lifelong wellness. And with that, let us begin this important conversation by introducing the esteemed panelists here today on the eve of World Health Day. We have the senior most, Dr. Rekha Bhatkhande here. She's MD Medicine, DM Gastroenterology, ex-Dean Sushrusha Hospital, Senior Consultant Gastroenterologist. A highly respected clinician and academic leader, Dr. Bhatkhande brings decades of excellence in gastroenterology and medical treatment. A highly respected clinician and academic leader, Dr. Bhatkhande brings decades of excellence in gastroenterology and medical education. She specializes in complex digestive disorders, liver diseases, and advanced endoscopic care. Her contributions extend beyond clinical practice into healthcare, leadership, and community service, making her a pillar in patient centered gastroenterological care. Next, we have with us Dr. Sagar Kerkar, MS Orthopedics, Fellowship in Arthroscopy, Sports Medicine, and Advanced Joint Replacement. He's consultant orthopedic surgeon, robotics, joint replacement, and sports injury specialist. Dr. Kerkar is a dynamic orthopedic surgeon specialized in multiple areas, including, of course, robotic joint replacement, arthroscopy, ligament reconstruction, and sports injury management. Known for his expertise in joint preservation and minimally invasive techniques, he focuses on restoring mobility, optimizing rehabilitation, and enabling long term functional recovery for active individuals and athletes. Then we have Dr. Amol Vadgaonkar with us. He's MD Medicine, DM Gastroenterology. He's consultant gastroenterologist at leading tertiary care centers. He's a promising gastroenterologist specializing in digestive disorders, liver diseases, and metabolic health. With expertise in advanced endoscopic procedures, and preventive care strategies, he focuses on delivering precise evidence-based management of gastrointestinal and lifestyle-related conditions. And last but not the least, we have our dear Dr. Puru Bansal here. He is MBBS MCH neurosurgery from NIMHANS. He is consultant neurosurgeon at leading hospitals across Thane, highly trained neurosurgeon with experience from leading institutions in India and abroad. Dr. Bansal specializes in minimally invasive brain and spine surgery, including advanced endoscopic skull and spinal procedures. With fellowships and dedicated training in both India and Japan, he combines state of art technology with meticulous, refined surgical expertise to achieve superior
Hello.
clinical outcomes and promote faster recovery in complex cases. So, with that, I am actually going to really jump into the questions that we have for all these experts out here, and it's a pleasure to have all of you here, um, uh, Dr. Bansal, Dr. Bhatkhande, Dr. Vadgaonkar, Dr. Kirkar. Um, Welcome to you all, and Dr. Vadgaonkar, I'm going to really start with you because, pretty much that I believe gut is so much prime to everything when it comes to health. And, gut conditions like IBS, IBD, which were quite much unknown to most of us until now, fatty liver, which is getting very, very common. What is really, in your opinion, that is driving this disease burden so much? And you know, are there newer techniques, and are the current techniques or treatments very, very effective in addressing the root causes and not just the symptoms? And how significant do you think even nutrition, gut repair strategies, enzymes, probiotics, how well are they placed in addressing all these conditions? I know there are a lot of questions in one for you, but I'm sure you're going to give us your insights on it.
Okay. Am I audible?
Yes, absolutely.
Yeah. First of all, thank you, Rajashree, for inviting me and on this podium. First of all, IBS, IBD, and fatty liver disease, these have a close relation to one another because fatty liver in itself basically is a condition where there is increase in inflammatory mediators and and what we call as a metabolic syndrome. So, metabolic syndrome drives the pathway for IBS, even IBD, and there are certain pathways through which this pathophysiology takes place because because your gut there is a gut brain axis, there is also a gut liver axis, and uh, also because of the gut issues there are a lot of this inflammatory mediators which are increased. So that's why what I feel is that in irritable bowel syndrome, where where there is increase in the gut brain axis, and it has risk factors. So risk factors such as if the mind is not quiet, if there is any infection, it can trigger the irritable bowel syndrome. Sometimes the food which we eat, if the food is not cooked properly, if there are certain raw vegetables which increase in the diet, that can increase the predisposition of the irritable bowel syndrome. And certain medications. So nowadays there are a lot of over-the-counter medication which the patient takes for some throat infection. They just pop up a pill. They take some antibiotics that hampers the gut microbiota, and then again it can lead to flare of the IBS symptoms. Now coming to IBD, IBD is there's a altered autoimmunity, where a person it develops a altered autoimmunity where there is inflammatory reaction to the intestines, and by that the patient may present with a bleeding PR or sometimes abdominal pain, and these are chronic inflammatory diseases, and this usually is being treated with certain medications, and these and which has to be taken on the long term basis. So, inflammatory bowel disease also have its nuances, and it is a long-term disease. Fatty liver, per se, it is not just related to the obese patients, but also we are seeing lean NASH. That is normal BMI patient. BMI patient can also have a fatty liver. That's why these certain patients who have a family history of fatty liver disease should be screened regularly, and of course obese patients should be screened for fatty liver. So we have to see the baseline biochemical parameters like CBC, LFTs, the creatinine, if the enzymes are elevated. Secondly, there are some radiological investigations like sonography, which can detect fatty liver, but you should not only depend on the sonography report. Sometimes the sonography report can be has its own fallacies, and it is interpreter dependent. That's why you should also get a fibroscan, which is a another non-invasive test, where you can also detect whether the fatty liver is there, and along with that the liver stiffness, because the liver stiffness value gives us the exact reading.
Great. So, after listening to you, we can see how much all this is complicated, interrelated, and, which is why people should realize that, gut, as it seems very, when we get all these symptoms, we just try to pop or maybe an antacid, or maybe we'll pop, like you said, we pop an antibiotic these days, even over the counter so many times. So all these has so much really complicated repercussions, and which is why we shouldn't be taking any gastric disturbances lightly, and if they're prolonging, we have to take, we should take rigid advice from the doctors, which I think we normally, yeah, including all of us, try to just neglect a lot of times. And um, being in the profession of being of nutrition, uh, do you really think nutrition intervention is actually driving, preventing, or also after people get diseases? Have you seen some promising results when people actually make alterations? Especially these days, people are eating a lot of junk foods. So, what's really your advice there?
So, so correct. So nutrition is an integral part of GI medicine. So because it plays a role, because it helps in improving the gut microbiota. So if it the proper nutrition and the vegetables, fruits, if they are taken properly in right quantity, then it helps the gut also. And also in those patients who are having acid peptic diseases or who's having functional dyspepsia, we usually give them a diet, low FODMAP diet, so that their symptoms are reduced along with the medicines. And also in inflammatory bowel diseases patients, uh, we always suggest them to take a Mediterranean type diet. Mediterranean type diet meaning to give more weightage on the fruits, vegetables, and sometimes fish also, but less of meaty foods. You know, Meaty foods, then junk foods like lot of this pizzas, burgers. These are processed foods, ultra processed foods. So these foods we should reduce in our diet. because they are not only causing more harm to the body, but in the long term they have a they are carcinogenic also, certain foods. So in the long term also it is not good for the patient. So yes, so nutrition always plays a role, and it helps us to build a gut immunity also.
Perfect. And with that, I think I'm going to bring in Dr. Bhatkhande here because she has years long of experience in treating patients, and has seen I would say the regular food habits which we had, which we would say, in Maharashtrians, we all normally say varan bhat, and so dal, rice, and today she probably sees her grandchildren uh, knowing and understanding junk. Forget about consuming it, but they're aware today. So how do you, ma'am, do you see this sharp rise today that we see in digestive disorders? Was it like that earlier, and or has it changed? Like Dr. Amol mentioned, many things as IBS, fatty liver, of course. These days, acidity has become so common that we just have realized that we can just live with it with antacids, and that's how we have been progressing. And also the elderly population, we see so much of steep rise in especially gastrointestinal issues with multiple other health problems that they have. So how do you sort of from your extensive experience, what would your insights that you could share with us, addressing the root causes and against this rising prevalence,
Thank you, Rajashree, for inviting me here today on Truwellth TV. It's a pleasure to be back. And I must thank Dr. Amol for a very scientific, basis to our prevalent gastrointestinal and liver disorders. Yes, you're right. The prevalence is rising very significantly, and you wanted to know the actual rise. And it was about 10 years ago, or maybe 15 years ago. Let's take fatty liver. Okay. Now, when we talk fatty liver, I'm not talking alcohol-induced fatty liver. I'm talking about non-alcoholic fatty liver, or what is now known as metabolic dysfunction associated fatty liver. Okay, so the prevalence today is about 33%. Okay, that means one in every three adults are showing fatty liver. But what is scarier is that one in every five children are showing a presence of a fatty liver. This is something that we need to address. Um, of course, diabetes and obesity and other metabolic disorders are more, no question about it. And perhaps that is the reason why. And of course, our dietary fads and our sedentary lifestyles, all this is actually contributing to this rising prevalence. Uh, the same thing actually is there with our acid peptic diseases, or diseases which are associated with hyperacidity, and the causative I would say factors which are causing other, peptic ulcer disease, which in fact, luckily for us, in Western India, the acid peptic disease, or the acidity, hyperacidity causing a problem, is usually reflux disease. In our part of the country, especially Gujarat, Maharashtra, we are seeing a lot of reflux disease, and this, of course, is the uh, prevalence of what we call as reflux, gastrointestinal reflux disease, is anything between about 8 to 30% in our population. But luckily for us, maybe because of better, I would say, water safety, food safety, um, the actual prevalence of peptic ulcer, as we used to see it 30 years ago, is only about 4 to 5% of the prevalence is about 4 to 5% in whatever studies that have been done. I'm now talking our region of the country. It is a little more in some of the southern states, but in our thing. Irritable bowel is such a common functional disorder in our country. I mean, there's no question about it. And it's the community survey shows it, that about maybe up to about 7% of our population has these functional disorders. But I need to make a point here. See, it's a very surprising finding, and really, what Dr. Amol has been telling us about all the investigation that need to be done. Almost 70% of patients with IBS, what the doctors have labeled as IBS, also have a coexisting fatty liver. So this is something that the population, because I'm now talking of community health, a population should also know that there's an overlap with IBS and fatty liver. Okay, so another thing is a very frightening picture that has come up in India, and that is about 1 million new cases of liver cirrhosis are detected in our country every year. So I think that's pretty serious. So we need to take fatty liver a little more seriously than what people are. Dr. Amol has told you about just sonography, and very often this is an incidental finding, and unfortunately, people do not give credence to the increased echogenicity seen in sonography, a fatty liver. It needs to be treated. So there is no such thing as a fatty liver is incidental. I have no problems. My LFTs are normal. You need to bring that under a medical supervision. Now, why does this happen? And see, root causes of all our, all these gastrointestinal diseases. And now I'm talking from the community health point of view. Okay, I've practiced gastroenterology for 48 years, but I've also been doing community healthcare and social work for the last 40 years. So I'm not going to talk from their point of view. Um, Processed food, which is unfortunately low in fiber, high in fat, high in salt, and high in sugar. One of the root causes of these disorders. Stress, which is very high nowadays, that has to be managed. And uh, infections, which can come through your contaminated water or food. But most important, and which I feel is something that all across the medical sector we are finding, and we are now making the population aware, is poor hydration. Unless you are told to restrict your fluid intake, please see that you're well hydrated. Half your problems are going to come under control with just good hydration. Then you ask whether current medical treatments. I mean, what is the role against versus symptom control? I'll tell you one thing, Rajashree. See, when a patient comes to a doctor, they expect to be questioned, investigated, diagnosed, and then treated by the doctor. Okay, and that can be a quick process or a process that goes over days or weeks. But what they actually want when we come to a doctor is quick symptom control. I've got bloating. What should I do about it? You know, this is other than what you're going to treat the actual cause of the bloating. They want a relief from that bloat. So it's not just about uh, giving current medical treatments, it is also about having what is known as your patient compliance to your medical treatment will increase if you can bring his symptoms, which are really troubling him, to some out of control. Okay? And of course, I totally agree. Digestive efficiency, enzyme function, nutrition, these have to be addressed. And when we talk about digestive efficiency, what we also need to take into account is the gut movement. See, the gut moves right from the throat down to the anal canal. There's a movement going on, a rhythmic process, and that sometimes is disturbed, and that can disturb your digestion. And another thing is, of course, mucosal integrity, which Amol has spoken about, and that is also very important. So I think all these are important and will definitely bring down the prevalence or the rising prevalence of these diseases if we were to uh, handle it and if the population was to take our advice. Rajashree?
So the reason why I really also wanted you to address the acidity issue is because not to show the pharma industry in bad light, but they are doing their job. But just as we have been now talking about overusage of antibiotics, uh, people should know that amongst the top 10 brands that are leading in the pharma, couple of them are these antacids, and and against vis-a-vis which you're telling me that we have lesser than 10% of peptic ulcers and these acidity issues. So, a conscious use of these needs to be done with proper advice, of course. That's why I wanted to highlight it. And also, like you said, the movement, the gut moves. And you spoke about, fiber and hydration being a problem. I think we probably, and I normally don't like to talk about nutraceutical products on this forum, but to realize, I've actually made a fiber drink so that the younger generation actually consumes it as if they're consuming a nice soda or drink, and that gives them fiber, that gives them hydration, which is something which is a very critical issue today. So instead of
Absolutely, totally
sodas,
agree.
drink a healthier drink, and it doesn't become habit forming. Is but at the same time, it's taking care of you, and they love the taste. So that's really what to be.
Yeah.
The when we
Actually, I'm glad Rajeshri, you brought up this antacid issue.
yeah.
Okay. It's actually antacids are supplementary to treatment of acid peptic diseases. Right? And they are on demand treatments. They, like I said, what does a patient really want? Quick resolution of their symptoms. Okay. So on demand treatment for acidity. But they people should remember that their effect is temporary. It only lasts for 1 to 3 hours. So if you are writing antacids for your patient, then you need to find out when should they be taking those antacids, because they're going to give them instant and very short-lived effect. And very often people, go according to a textbook. You take it after meals. But when after meals? When is the maximum release of acid? And in a patient who is actually having hyperacidity, what will relieve him? So I think antacids is something that really should not just be, I've kept a bottle of an antacid in my fridge and I just open it and I just take it. It should be done because every, see, the Amol, because I can see Amol.
Yes.
Amol, what the first day in JJ, that is GMC, first day, first thing that we were taught, primarily do no harm.
Yeah.
So people don't realize that even something as simple as an antacid can actually harm people. You know.
Yeah,
So I think that is
I
one of
agree
the
with
things.
Yes.
Madam.
Yes.
And this antacids should not be randomly used, because some of these antacids can, especially in patients who have comorbidities and those who are elderly patients, they can have precipitating constipation also, because
Yeah,
it contains aluminum hydroxide. Some antacid contains magnesium substances which can cause diarrhea. So random use of antacid should be prohibited. And also the
totally agree.
and PPI
Please
also,
go ahead. Go ahead.
PPI also, because this
Very
proton pump inhibitors, which patients they do take for maybe months together. This also, this is not recommended. This should be tapered off, and SOS on the case to case basis. It should be tapered off, and it should be taken SOS. And because of that also, chronic use of PPI or gut microbiota imbalance happens,
Yes.
and lot of this uh, uh,
dispatch.
irritable bowel syndrome or IBS symptoms, they crop up because of the chronic PPI use also.
Yes. So
But something, Rajashree, I must tell you. See, when PPIs were first launched, in fact, your dad was, in
yes.
the
Yes.
field at that time.
Yeah.
When PPIs were first launched, we never expected that 30 years down the line, they are going to tell us that PPIs are not good for your kidney health. You know, we were never told that. I mean, what Amol says is about dysbiosis in the gut, but even in other organs, we were never told that really.
So yeah, I mean, which is really good that we are addressing this, and I think we will actively keep talking about this on our platform. I think thank you to both of you for bringing this up so evidently. With that, I think I'll move on to the next most prevalent issue, and I'm going to come to Dr. Puru at the end because that's my favorite topic. But before that, I want to come to the next most prevalent orthopedic issues are again something which with age was something which we had a preconception. So we have Dr. Kelkar here. Dr. Sagar, are you so we always keep talking about the older patients, and the elderly population keeps having orthopedic issues, but today we are seeing that younger population is also getting so much affected, and injuries have become extremely common, joint pain issues have become common, mobility issues we're seeing because too much of just being taking your phones all the time and being on your sofa. So, all these things are, driving so many different issues, muscle loss, then, there's poor training, lifestyle, of course, like I mentioned, we are, I wouldn't say rampantly poor, but yes, increasingly not as great that it should be. So what's your take on all this?
So thank you, Rajashree, and thank you for inviting me to the Truwellth Forum, and congratulations, Bhatkhande ma'am, for your award. Uh, yes, it's a rampant thing. So basically the definition of young has changed, and as far as I am concerned, even Bhatkhande ma'am is still young, and
Absolutely.
the
I
young.
said senior, not young, not old.
So the definition of young has changed, and I feel the young now is not 30s or 40s; it's around 55s. So we find a lot of young arthritic knees, and young people technically who are suffering from issues which were not seen at this age. Let's say a few years or few decades back. What we can see is the two things which are on the rise. One is stress, which is unfortunately a part of our life, and we have to deal with it, not necessarily with medications. And second is lifestyle, which is mainly has become sedentary, AC room based, and we have to take an effort to go out and keep our joints, bones healthy. I think this has caused a lot the mobile generation, where all the excitement that you want is on your fingertips and not outside, has caused a lot of sedentary issues, which have led to rise of young arthritic knee. And second, uh, one more thing that we can address is the nutrition, which Dr. Amol and Bhatkhande ma'am have rightly said. Uh, Nutrition and psychological well-being also play a lot of part in arthritis. Arthritis, when you add anything, is inflammation. It is not necessary wearing off of our cartilage and everything. Our body is miraculous. It just helps in ways that we won't even understand. But when we put all these in triggering factors which cause these issues, these issues of arthritis and young arthritic knee, joint pain, people who are in school coming with have chronic back pain is not heard of very commonly. Uh, so yeah, good lifestyle, good nutrition, good psychological well-being will definitely help in reducing these young people problems. And what we have to understand is we have to make sure that we test our body in resistance training. We feel that resistance training is for gym buffs, which is I feel is not right. When we see for any muscle or any bone well-being, we have to test it. We have to keep it under constant. We have to, give it some resistance so that it's like a bow and arrow. If we just keep it still, it's not. It's going to be stationary. But if we want it to go ahead, we have to put it under some tension. If I'm sorry if it's not a very correlative example, but resistance training, some form of physical exercise daily. It's like brushing our teeth. We don't go to the dentist twice a quarter and just tell them clean our teeth. We brush our teeth for 5 minutes a day to make sure our teeth are healthy. Something like that. We have to do something for half an hour, 1 hour a day to make sure that our the machine that we have got, like the body that we have, is servicing us well. I think that's in what I have feel what I feel helps good for betterment of young arthritic knees. Yes, Raj.
So I'm glad to see you being mobile while you're talking about all these mobility and strength training techniques, and you're absolutely bang on when you said itis is inflammation, which really needs to be addressed today. And glad, I mean, we shouldn't be thanking COVID for things, but yeah, one of these things is at least inflammation got some highlight and people have started realizing. And you're bang on when you're saying the younger generation should focus on doing strength training from the initial days, and so much is being common. The good part is at least they're getting aware. So more the information that we can actually circulate to them in the right scientific method, I think that's increasingly going to help. And they, on the contrary, want to know. I mean, we in our times, we probably didn't even know that what questions to ask. gladly they at least know. So, a good
Yeah.
amount of awareness can actually, it can mitigate what's actually happening with the sedentary lifestyles and the mobile generation, like you said. But having said that, I think the newer generation is also bringing in newer techniques. And today, robotics
Yes.
is actually becoming, instead of saying that robotics is new, now robotics is becoming something which is a part of life for you surgeons. And we have all these minimally invasive techniques. So are they really, because people have apprehensions if they should be doing it, are they really improving outcomes? And so this is one part of it. And also after these surgeries, what people normally neglect is the rehab, or how do they recover out of it. Recovery and rehab are two important portions of addressing the surgery. Is something, if you can highlight what you see out of your experience, I think that will be great.
So thank you, Rajashree, for getting that point. See, concepts don't change. Technology gets introduced. You need to know how to use the technology. It's like you having a Ferrari but not knowing how to drive it. Then what's the use of it? Just having a Ferrari doesn't make you a good driver. So the concepts of surgery don't change. Obviously there are some advancements that we need to be aware of, and we have to absolutely use technology to fine tune the results. What robotics has given is we can now customize the replacement surgeries, joint replacement surgeries for that particular patient, which initially we had to follow a particular concept and make we have to give one fit for all. But I'm sure everybody knows that not two of us are the same. It's like wearing a off the rack t-shirt and tailoring the shirt to your fitting. It definitely gives you a better fit. So robotics has definitely helped in that era. Minimally invasive surgeries and all. See, those are for once you have been trained enough in that, uh, that definitely helps in delivering better results. But the concepts don't change. Doing a better job is better than doing a minimally invasive job. And having said that, yes, it requires a lot of training, and it requires a lot of vigilance and patience to make sure that we get good results in newer techniques. Uh, and what you rightly pointed out, just because you have had a joint replacement surgery doesn't mean that you are going to run a marathon next day. It's treating the symptoms to, main cause, but for us to get used to that surgery, we have to have a good physiotherapy and exercises to get used to the surgery and the implants that we have put in. Physical therapy, fortunately, is now getting a good vogue. I think it should never be out of vogue. And the better the physiotherapy, the better mental conditioning and physical conditioning that a patient does after a surgery. I have seen miraculous results even in 95 years old, and in people who are not having a positive attitude, even at 55 years of age, they struggle to get to a optimum result. So physical therapy and normal exercises post surgery are absolutely important to get a optimum result.
Great. So I think I will have a couple of questions later for you,
Sure.
but I will now progressively to orthopedics and a mix of the brain and our neurological system, which is extensive in the body. I have multiple questions for Dr. Puru Bansal also. Dr. Puru, this is something which you're evidently seeing, which no one, I mean, brain and surgeries and all this would probably be 1% of what we used to hear. And today, neurological conditions are probably uh, I think they're the fastest growing in of course the aging population. So it's increasingly becoming an issue. Menopause is another area which may not be the middle age again. Those areas also. There is so much that is actually on a rise. And uh, we all, I mean, neck pain, cervical issues with corporate lifestyles, and not just corporate lifestyles, but the way our whole day is structured, I think it's just increasing. We get random headaches, and all obviously try to link it to stress and whatever. But do we really understand all this? Because this is again so interrelated, complicated, and I know today's session is not going to be enough to to learn from you about it, because there's so much. But if you can share some of your insights on that, how people can understand, it's lifestyle driven, but it's also, it's a structural disease, which a lot of times people fail to understand. They feel they need to take more care, instead of actually, like Dr. Kelkar said, we actually need to do stretch ourselves and strength train, and do so many of these things. So if you could address some of these issues, and I'll obviously ask more questions.
Thank you, Rajashree madam. And so I've heard everybody speak about it, and basically I think everybody is saying the same thing, that all of these problems start actually as a lifestyle choice, and probably from an early childhood. Like, you sit in a school, you sit on a desk. The desk is the same for everyone, whether you're tall, whether you're short, you have to use the same desk. So whether you're hunched over, or whether you're trying to climb over the desk and write, it's going to vary for everyone else. So it's not ergonomically placed from a very early age. As we are more and more academically demanding of children, the requirement to sit in a place for a prolonged period keeps increasing. You try to hold a glass in your hand for a prolonged period of time, I don't think anybody can do it for more than a half an hour before they start feeling so much pain that they will have to keep it down. Body muscles are pretty much the same. The joints, they'll support for about half an hour, maybe hour and a half, because they're meant to do that. But after that, they also start getting tired. So without adequate training, without adequate mobility, while you're doing these activities, eventually our joints, our discs, our muscles, ligaments, everything start getting strained. And this is what basically starts off as a lifestyle driven disease. And eventually, after this strain has been there for decades, this becomes a structural disease. When it becomes a structural disease, that time, of course, lifestyle changes can reverse some of the changes which have happened in the structure, but we have to understand then sometimes surgeons do need to intervene, and Dr. Kelkar and I will also have to intervene in such cases, because lifestyle choices have eventually changed the body. Now, research has shown that most of your neck pains and back pains are genetic. So about 85% of the chances that you would get a neck pain or back pain which is severe enough to require any intervention is genetic, but 15% is totally lifestyle dependent. So that 15% is what we can regulate by making being mobile. Basically, don't sit in one place for a prolonged period of time. Don't stand in one place for a prolonged period of time. Don't stay in one posture for a prolonged time. Let your whole body get involved whenever you're doing something. Okay. When it comes to the brain, so the brain also is very much lifestyle dependent. If you would consider evolution over the last century, our sleep has not really improved. We have not really started sleeping more as a whole human population. We have not started sleeping better as a whole human population. Previously, at sundown, we would sleep and we would get up at sunrise. Now, because of blue light screens, availability of incandescent bulbs, we are pretty much awake most of the time. So sleep forms a very important part of the brain's regeneration capability. We are losing out on that regeneration capability because as our lifestyle changes, as our requirement changes, we have been trying to keep awake for longer periods. Now the continuous use of screens is one of the worst things that we are doing to our brain. I think everybody is we have reels on continuously available that you can actually keep scrolling, which would be explaining this phenomenon, that what we call as a dopamine addiction or doom scrolling, that you keep scrolling, keep getting a hit of dopamine from each new short form of entertainment. Basically, that has taught us that we don't need to rest. We can get continuous dopamine hits and keep ourselves satisfied without having to actually do something meaningful or even having to move out of our chair or bed. So overall, this has led to a decreased ability to focus, because you don't need to focus and achieve something to get that dopamine hit. It has reduced our ability to retain facts, because all facts are now available on a machine which is there in your hand. And eventually this has increased degeneration of the brain. And even though the current generation, as we progress, is getting smarter and smarter, the ability to retain that intelligence has decreased with age. Like Dr. Rekha madam was saying, at this stage as well, she is so active, so energetic. I'm worried that whether our generation or the generations later on would be able to mimic that, because we have been stimulated so much, overstimulated from a very young age. So these things are eventually causing structural changes in the brain. We see atrophy. Madam and Dr. Amol both spoke about gut brain axis, brain gut axis. So the gut brain axis also is responsible for our memory areas. Like they have noted that people who are not having a good gut microbiome have atrophied hippocampi. Hippocampi are the areas which convert our verbal memory into long-term emotional memories. Let us retain information for a longer period of time. So we see structural changes in people who have had poor gut health for a long period of time. These are not reversible. These are going to be there. So this choice once made, that okay, I'm going to change this part of my own body from what is naturally needed for my body, this changes then remain lifelong. Starts up as a lifestyle choice and becomes a structural disease eventually, and doesn't always reverse when you change your lifestyle choice.
uh, Multiple issues you've already taken care of and alerted us on, and you've correlated everything: sleep, stress, and brain, and our physique, and of course so that lastly brings us to the question on nutrition. If nutrition does really play a role, because we all know that brain and our neurological health is the most irreversible of the many that we have. So how significant it is to eat right things, or are there any foods which specifically you recommend people should consistently eat? Because again, like all of you are saying, everything doesn't happen. You can't just pop a pill and it's done. It's over a period. Your nutrition and lifestyle both has to be progressively good. So, do you have any recommendations on that front?
So I think this part also has evolved over time. But I mean, from what we have seen, research showed in 1970s to what we are learning now has changed a lot. In Indian diet, that we have noted from the very start, I have heard my grandparents even speak about that. Turmeric, haldi, and dalchini, cinnamon, has been always regarded as something which is very, very good for the brain. So these things basically, which we were adding on to food bit by bit, not in a very large quantity. Large quantity, of course, it's hurtful, but they're very, very useful. Apart from that, of course, a good high protein diet, because a healthy body will only house a healthy brain. So high protein, rich in the good kind of fatty acids, and relatively well balanced carbohydrate diet. You need a good amount of fibrous and starchy carbohydrates. So basically, that is the part where nutrition plays. Adding on some things which have good quantity of antioxidants, such as blueberries, of course, will help.
Yeah.
But those are not the foods which are native to our region. What foods which we have consumed for decades, something like haldi or cinnamon, are much more suited to our Indian body types. So nutrition definitely plays a role. salt intake, as simple as that, is responsible for blood pressure controls to a very large extent. And eventually it is also responsible for the chances of you getting a stroke, a bleed in the brain, or something known as aneurysmal rupture in the brain, all these as a consequence of just dietary changes. Even dietary inflammation has been a very major topic of interest regarding this, that dietary inflammation can directly reduce something known as brain derived neurotropic factor, BDNF. And that is a part which eventually leads to acceleration of age associated dementia, age associated memory loss. So nutrition management is something that we need to be actively involved in as early as possible, preferably from a very young age. The parents should be involved, and as soon as you can regulate your own diet, you should be very focused that you eat the right things at the right time with the right mindset, so that you get the best possible results from it. I wouldn't say that you can actually reverse things that have happened just by nutrition, but if you take care of it from a start, then probably you'll have a better life and better outcome as far as the brain is concerned.
So again, you're really highlighting the holistic approach at things, and you've already given us a topic for the next session. You said dietary inflammation, and I'm sure Dr. Kirkar mentioned about inflammationitis, and also I mean Dr. Bhatkhande and Dr. Amol, they are of course going to add so much value to this topic. So this is a topic which really needs to be addressed, and it is a root cause of so many metabolic diseases. I can actually talk for hours on this topic. But having said that, I think couple of things which Dr. Amol mentioned, the Mediterranean diet. So, actually you said gut and brain axis and brain gut axis. So, it's both which ways. So fish is actually a very good food which we can evidently add, and we have ample of it, if we decide to eat the right fish again, all the types of fish don't have equal amount of EPA, DHA. So we need to know all that. And fruits, like you mentioned, we tend to turn to berries because there is a lot of data on it. But simple food like guava has so much of antioxidants, and pineapples and oranges. All these can be really added to our diet. But now I'll actually get on to our our cross panel questions here, which any of you can take, whoever wants to add to it. We see a lot of noise today, and I'm at a point where I literally where Dr. Kerkar was mentioning reels. Dr. Kerkar, I actually tend to say no to those posts because there's so much spoken about these supplements and so many advertisements. It's so confusing for even a specialist like me. What's going on? So much of bombardment that's going on supplements. At the same time, we see that still people are lacking in high protein diets when there's so much of protein misinformation and so much of noise is going on that front. So what do we come about with this? And if you can share all your insights that you want, are we over supplementing, or are we really under supplementing where it's actually needed? What do each of you see in your experience? Any one of you can go on.
Yeah. So from the GI point of view,
Yes,
uh,
Dr. Amol.
yeah. So from the GI point of view, see,
Yeah, I think we lost him for a bit. Um, Maybe any of you, Dr. Puru or Dr. Sagar, any one of you can
Yeah.
share your.
So in my practice, usually I see most often it is a nutritional imbalance. I don't get, most of my patients are not high performing
Yeah.
athletes with
Yes.
optimized nutrition. They have been on imbalanced diets for a long time. They have very poor muscle mass,
Yeah.
most of our patients. And during the recovery period and during the rehab period, or even when they come as for the first time for just basic muscle pains, neck pains, or headaches, my advice always remains that
Yeah.
you need to have a better diet.
Yeah.
Of course, I'm not the best person to advise the kind of diet
Yeah.
that is necessary, but what we consider is get your proteins done first
Yeah.
and then manage the rest of it, including the micronutrients. So
Yeah.
that forms a very major issue that I don't see people who are over supplementing. I see people who are more commonly undernourished.
Yes. And I'll tell you why, because there's data which says that only 15% of people actually see these reels and ads. So, the actual ones who suffering are not even getting exposed to any of this information. And sometimes if they get exposed to wrong information through social media, universities, it's actually going to be more detrimental. So these kind of things also, it's better they take advice from the doctors and nutritionists and more qualified professionals. It's always a better thing to do. But Dr. Amol, you're back, so I think you were adding your inputs. It's gone again. Yes, yes, Dr. Sagar, did you want to add?
Yeah, sorry.
No, go ahead.
What was the question? Can you please
So
ask?
basically, we're seeing so much. I think this is something where you really need to add value because there's so
Yes.
much of noise today on, varied supplementation, and you see so many reels and ads going on social media, and so much. I wouldn't call everything is misinformation, but a lot of it is overhype. So, do you think that we are actually over supplementing, or are we under supplementing? Because Dr. Puru said, most of his patients are actually undernourished instead of being really taking the right things. So in your opinion, is this overhype really good? Is it even effective? What's your take on it?
So, because I deal with a lot, I must say that we have been focusing too much on supplementing. What we need to basically focus on is proper diet and good sleep, as Dr. Puru said. Nothing in this world can repair your inner damage like good sleep. Nothing in this world. No form of supplement is going to repair that. So we are definitely over supplementing as far as I'm concerned. But what happens is we want to get a shortcut to things rather than letting our body see everything good in this life is going to take some time. But we want instant validation, we want instant results. And that's why we are looking for, earlier it was allopathy. Now we are looking for nutritional supplementation. What we need to focus on is absolutely good diet. We are definitely open over supplementing. And second thing is good sleep. That is going to take care of whatever deficiencies you are having. And second, yes, there are definitely indications where supplements are required, and for that there are good lots of literature as to what supplements you should take. Just because you you are taking a calcium supplement doesn't mean even 10% of the calcium supplement is getting in your body in the form that the body really wants.
Absolutely.
So we have to make sure that we are taking the right supplements. So even for a short course or a properly guided course will definitely help more than a random course of for 2 months or 3 months.
Yeah, absolutely right. I mean, this is my area of expertise. So people don't realize the word supplementation means it's supplementing. It's not living on it. So,
Exactly.
you're supplementing how much you supplement for how long. And you rightly, again, like PPIs, which was pointed out by Dr. Bhatkhande, equally, calcium supplements. Uh, People have been popping calcium supplements, and, we see growing sales of calcium brands, but are we eating the calcium with the right vitamins again? Because for
Yeah.
all this time, we first ate only calcium. Then we realized we have to eat vitamin D with it. Now we
Yeah.
realize we have to, this data has always been there that vitamin K27 has to be taken with it so that calcification risk can reduce. But
Yeah.
it's now prevalent. So now we know that we need to take that along also. So there has to be an holistic approach to all these things and what
Abs-
has to be eaten rightly,
Yes.
especially when you're supplementing along with a balanced nutrition, that you should be taking. It has to be all together. It can't be either or.
You can't pick and choose. You can't just pick and choose supplements to benefit one part of your body. It has to be holistic.
So I think, yes, ma'am.
Rajashree,
Yes, ma'am.
yeah. So I need to bring up one clinical entity here, which I find in my senior citizens. You know, I've been working for senior citizens last 30 years, and that is sarcopenia. Okay,
Yeah.
sarcopenia is something which is we have seen in this last 8 months. There has been not just flu, but there's been a almost endemic pneumonia. Okay, community acquired pneumonia, and we have seen that it's very difficult to wean senior citizens off the respirator or any assisted ventilation device because of the sarcopenia. All right. So this is where your proteins judicially given and very rightly. I mean, is it the plant protein you need to give? Is it the animal protein you need to give in the food, or then a protein supplement? But sarcopenia is something that the orthopedics, the gastroenterologists, our neurologists, neurosurgeons. I mean, everybody needs to, address this one issue is that our patients have got sarcopenia.
So I think, like you rightly said, ma'am, that protein need to be from. People keep asking when I'm on sessions, they'll ask which oils to eat, which are the safer ones, which are the good ones. Same goes with protein. So, taking multiple sources is a better idea always so that you get the right nutrients from the right ones. Of course, I'm saying this very top level right now, but there are specifics when it comes to proteins and as well as fats. So, you have to be very intelligently choosing them when you're doing that. Dr. Amol, did you want to
Yeah.
add to this? Thing? Because I also have uh, I mean, all of you also pointed out that it has to be evidence based, because this is something which again, there is, everyone feels there is not enough evidence, but there is evidence if we try to dig it, and the evidence is only growing. So I think, Dr. Amol, did you want to add your inputs to this topic? I think I'm able to hear.
Yeah, yeah. So
Yeah,
one thing that I think while choosing the protein powder or any protein powder preparation, we
yeah,
should always
yes,
see
yes,
the ingredients, what it is supplying, to our body. So always choose a whey isolate protein. We should
yeah,
avoid any creatinine phosphate contain protein because it might lead to acute kidney injury,
yeah,
and
totally.
those patients who require, sometimes chronic liver disease patients, sometimes chronic kidney disease patients who are on dialysis, sometimes they need to be nutritionally replenished. uh, and also, as madam rightly suggested, that most of the Indian patients are sarcopenic, which goes undiagnosed, and adequate amount of protein is not been given to them. So these patients should be given additional protein intake should be given, so that they are well optimized. And yes, that's about it.
So yeah, I mean, it pains me to see that there are so many ads going on on protein supplements these days, but we still not even address 10% of this issue of, so very important how do we give the proteins? It's not only what proteins, but if it's not a very difficult math or it's not a very complicated thing, even in renal patients we can achieve it if we can very smartly do it. But it needs a lot of experience and smartness that you can use and address this issue again. So, with that, I'll come to our interesting session, which is the rapid fire round, and I will request you all to be as short as possible so that this becomes a little bit more fun and interesting. Uh, whom should I go with the first? I think I will go with Dr. Bhatkhande first because, ma'am, I'm rapid fire for you, and I know how rapid and good you are in our earlier sessions you've been. So when it comes to acidity, is it excess acid or is it weak digestion?
See, this question so for me is a combination of both. Okay,
Correct.
but let me be more, to the point. So, if it is a hyperacidity thing, then acidity means hyperacidity,
Yes.
and then there are definite ways to tackle that. But when it comes to what we call as non-ulcer dyspepsia, the dyspepsias, most of those are because of digestion, weakness in the digestive system, let me say, which also includes, the gut and movement and everything like that. So,
So,
yeah.
so the next,
Excess acid, yes. Hyperacidity.
so
Okay.
so these questions are
The
turning
next,
these questions are turning out to be like the coffee with cake kind of thing. So the next one is sugar. Sugar, is it the biggest metabolic
so
villain according to you?
okay, so sugar is a villain. There is no question about it. Okay, but what we have to realize is the staple of this entire sugar dysmetabolism is insulin resistance. I mean, if insulin resistance wasn't there, then maybe people would have been digesting the sugar a whole lot better, and it wouldn't have caused all the problems. So,
So the next
villain, yes, but not the main villain.
yeah,
Villain, yes, but not the main villain.
the next one is fasting.
Fasting.
Fasting beneficial or overhyped?
Uh, See, I've never fasted in my life unless it's because of work and I'm missing a meal because of that or something like that. To me, and that is also going to be my takeaway, is that you need to control the portion of your food portion. If your calories are controlled, you don't have to fast. You have a regular pattern of eating and control the calorie intake, and that works.
Glad you're saying said this.
Gas.
Totally 100% agree with you. The next one is gas, normal or warning sign.
So gas is normal. We are producing anything between 350 to about 400 cc's of gas every day. And I believe we are passing gas about 20 to 25 times a day. Yes. But luckily, only 1% of that gas is odorful, okay, meaning it's a bad odor. And that is because of the sulfur containing items that we eat. So my suggestion to all office goers who are very embarrassed about this, gas in their workplace is do not eat anything that contains like chana and things like that contains sulfur containing things, so you don't produce methane, so you don't have an odor gas. Otherwise, it's normal.
And then gut feeling versus
The
gut health. Which matters more to you?
Okay, so now gut feeling has for centuries been spoken of as a mental health, mental, thing. But gut health, when we talk about gut health, we're talking about the microbiome and if that is working well, if there are good bacteria and what have you, that the gut health is maintained. And if it is not, then what they call a dysbiosis. But where gut feeling is concerned, we've always realized that if your gut is, calm, behaving well, your moods are better. You're more at peace, and so your gut feeling that comes from all this, and I think Amol has spoke about it at length, all the different types of connections, brain, liver, and gut, is that yeah, so good health,
Yeah. Yeah.
good gut health, and
Yes.
you're going to feel good.
Yes, that's the
That's it.
message we take. Good gut health, absolutely. And then going over to Dr. Amol, since ma'am mentioned his name, so and obviously we want to know about more about the gut health. Is IBS, is it stress driven or food driven?
So both. So I would say both, because stress, like I initially also said, there is a gut-brain axis. So
Yeah,
uh, whatever there is more of thinking, there is release of serotonin and
yeah,
dopamine from the brain. It acts on your stomach, causes
yes,
increased motility. So yes, stress-driven as well as food-driven, because certain food that the patient has intolerance to can aggravate the situation. So certain like milk products are there. Sometimes
yeah,
patient does not suit wheat, can create bloating. Then again there are some nuts, peanuts, which may aggravate abdominal
yes,
pain.
absolutely.
So both.
Then, according to you, what is the most ignored gut symptom?
So I think uh, sometimes
Only you can answer this.
ignored, yeah, so ignored gut symptoms like a weight loss, you know.
Okay. Wow.
So weight loss should not be ignored. I think it
Great.
is one of the warning signs, alarming symptom where you should investigate. If there is, dyspepsia is there, so bloating or sometimes acidity, these are there. But if the patient also has vomiting,
Yes.
should not ignore such symptoms.
Okay.
So these are certain warning symptoms like persistent vomiting. Sometimes you have just a unexplained anemia
Yeah.
along with some gut symptom. You should not ignore that.
Right. Also, people might be asking you, of course, tea on empty stomach, okay or no?
So tea on empty stomach, I would generally avoid it. Sometimes it can aggravate acidity.
Yes.
It can cause bloating. So I think it can be taken with a snack, with any
Yeah.
snack. But sometimes uh, people take 3-4 cups of tea in a day,
Yeah. Yeah.
and they also add milk. So usually we Indian people, we don't usually take black tea.
Right.
Sometimes we add milk, and that can sometimes give rise
Yes.
to bloating, sometimes burping,
Yeah.
recurrent belching episodes.
Yes.
So associated with some snack.
Yes. Absolutely. And then, apart from that, the enzymes, which is my favorite topic, enzymes are helpful or they're unnecessary.
So in certain indications, not
Yes.
always.
Correct.
But if the patient is having weak digestion and have been having symptoms of, if you can say, diarrhea or some chronic diarrhea symptoms, where enzyme supplementation can aid his digestion, but it should be given for a particular duration. It should not be carried out for just continuously for 6 months or a year, but for a particular duration. And certain patients who have chronic pancreatic insufficiency, so certain patients who have weight loss and you diagnose those patients who have chronic pancreatic insufficiency, yes, you can add enzyme preparation which help them to digest the food better. So it should not be randomly
Yes.
popped up,
Yes.
but it should be given with the right indication.
Mm. So, also to add to that, I mean, I think the inflammation, the food inflammation that you're talking about, this is another major indication. So, this is an extensive discussion, but just to add, the last question for you is detox. Is it needed or is it a myth?
I think detox is overhyped. It is overhyped. Normally, our foods which has natural antioxidants, uh, as Dr. Puru Bansal mentioned, that turmeric, excellent antioxidant property, has a healing property.
Yeah.
So, and usually our food has had good detox and especially hydration. Normally, people forget hydration
Yes.
because uh, if you have a good amount of hydration, have 2 to 3 liters water intake in a day, it will
Yeah.
flush good amount of toxins from your body.
Absolutely.
Maintaining a good liver health,
Yeah.
because liver is one such organ which detoxifies your entire body toxins.
Yes.
So if you have a fatty liver, then get it treated. you know it will also detox. So I don't think I think detox is a
It is
over.
absolutely overhyped, like you rightly
Yeah,
said. When it's needed, you can do it for a short term if required,
yes, yes.
and it otherwise has to be naturally with your foods,
Yeah, because
as
what is
part of your
happening
food.
is that there are a lot of YouTube reels with certain
Yes,
Ayurvedic medicines, certain which causes detoxing effect, but the
yes,
people don't realize that it has some harmful effect also.
absolutely.
So, per patients, they do come to us with certain liver injuries after taking these detoxifying medications,
Yes.
and that problem then percolates to the other things also.
Glad you added this point because this was very important. Then moving on to Dr. Kerkar now for his rapid fire, is rest or rehab? Dr. Kirkar. Rest
Uh,
or rehab? You
both,
said sleep is most important, but rest or
both,
rehab?
both,
Correct.
obviously both.
Both.
It has different
Both.
functions.
And the next one is walking enough. Are we walking enough? I mean, if we walk enough, is it enough? Or, yes or no?
For what is the aim? If the aim,
People these days think, मैंने तो चल लिया. I walked 45 minutes today.
yeah,
Is it enough?
for a good, see, uh, steady state cardiovascular exercise
Yeah.
in phase two, I think it is supposed to be below, it's supposed to keep our heart rate below 135.
Yeah.
So you walk or jog at a conversational pace.
Correct.
That's what is more important. And if you walk enough, it is definitely going to burn more calories. See, the aim is what you want. Whether you want to burn calories, whether you want to be in calorie deficit, whether you want to lose fat, you want to build muscle, then walking is something which is good cardiovascular exercise for burning calories.
Okay. The next one is anti-inflammatory supplements, essential or hype?
If required, yes.
Okay.
It's not definitely not hype. Indications need to be assessed and then prescribed.
Perfect. Uh, Top injury cause that you think,
No
especially in
warm
the
up.
young, no warm up. Yeah. Wow, this is something which the Gen Z should hear very loudly, actually, I would say. No warm up. And healthy snacks, do you really think they're actually healthy? I mean, you see so many of these packaged foods today which say claim they're healthy. Do you
Processed
really
foods
see?
are not healthy.
And any other claims where people say this is a healthy snack? Um,
Mm.
Again, it has to be questioned, really.
Yeah, I
But
mean, we should
yeah.
have we should take everything which is marketable as with a grain of salt.
Yeah. And then one exercise you recommend for the Gen Z especially.
For the Gen Z,
Warm up.
no, depends on what you want. But
Yeah.
fortunately, you know what? Gen Zs have taken up resistance training very nicely,
Yeah.
and it's a very good thing to see. So yes, the resistance training to whatever capacity you have. You don't have to wait. Use 40 kgs dumbbell every time.
True.
Resistance training, yes.
Then the next rapid fire is for Dr. Puru Bansal. Mobile in hand or pillow, what damages the neck more?
Mobile in hand, definitely. But you can actually improve it by just tucking the other hand underneath. Tuck
Okay.
the other hand underneath.
Yeah, I'm sure the younger population is going to really like you for saying all these things. Your spine prefers gym, yoga, or just less sitting?
Whatever you're not doing. If you
Smart,
are
really
sitting
smart.
too much, you need to stop sitting. If you aren't flexible enough, you're not doing yoga, you need to do yoga. If you're not going to the gym, start going to the gym.
Yes. So all three are essential, really,
Yes, yes.
in a balanced way. And one habit your brain wishes humans would stop immediately.
Denying sleep.
Okay, perfect. So sleep has evidently come out of our discussions today, and this madam already uh, pointed out very loudly: is water most underrated nutrient?
Oh, yes, by far. Madam has already mentioned it.
Anything from the neurological side that you could add? If you don't hydrate well, how much does it affect the brain cells?
So it affects it a lot. Dehydration actually can shows if progressive dehydration, like you see in even how do I say it? You see it in Hollywood actors, right? They dehydrated themselves for roles. So if you
Yeah.
get an MRI done there, you will see the brain also shrinking at that time. It is that significant. You can see structural changes just by dehydration.
And then the last couple of ones for you. Uh, Best exercise for longevity.
For longevity, it is walking, no doubt.
And then walking, is it enough? Yes or no? I
No,
asked this.
never, never, never. You are supposed walking is just like you said for longevity, cardiovascular health, general health, with
Yes.
all the pains in your life, walking is the most sustainable and the best exercise.
And
Rajashree,
yeah,
may I interrupt and ask Dr. Bansal one question?
yes, go ahead.
For the senior citizens, okay, is a figure of eight walking good? I mean, does it improve their balance,
Oh,
their
yeah.
mentation, everything? Figure of eight walking.
Yes. So basically, madam, the thing is that if you are able to complete a figure of 8 walking, that means your cerebellum is good and your muscular tone is good. So it is a good test as well, and it is a method of training. It's a very good passive vestibular exercise. Just walking in figure of 8, continuously changing your direction, very good exercise.
Thank
Uh,
you. Yeah.
Last question for you, Dr. Puru, is I'm asking this wasn't decided, but came out of ma'am's pointing out earlier. Gut feeling or brain sense?
Brain sense.
Yeah, now you're being obviously a neurosurgeon, so that was expected. But I think it was very interesting, insightful and interesting, and a lot of fun to learn so many things from you. Me myself has learned so much. I'm sure we panelists have learned so much from each other today, and obviously the audience who's attending now is it going to enjoy. We're going to make sure this session actually reaches to minimum of 10,000 people. So, we can propagate all our messages for the health day, which is why we tried to do that couple of days before on a Sunday. And now till the time it's World Health Day on Tuesday, we can propagate our messages to more and more people. That's going to be our, goal. Also, with that, while we conclude the meeting, I would request you all to, in short, give your key takeaways, or you could mention what one myth we should just forget forever, and one powerful habit that we should practice regularly. Dr. Bhatkhande, we start with you.
Okay. So one thing is my takeaway actually would be what I've been saying all through. Manage your stress, exercise regularly, prioritize sleep, and we've all been saying this,
Yes.
and establish a eating routine. I really believe in that. In fact, that is going to be my habit that you should practice regularly. Establish a routine in your eating, regular times. It will help maintain your your gut function, as well as improve the digestive efficiency. Okay. Now, the myth that I would like to talk about, and this is really quite something, I'm sticking my neck out here. The non-doctors have absolutely no, I would say, uh, they should not be talking about a leaky gut. It's a myth where the public is concerned. Where doctors are concerned, they understand that a leaky gut means hyper permeability, and there are certain, of the gut, and there are certain diseases that do that. But this public awareness that has come in, leaky gut, so take this and take that, I think this is very wrong. There is nothing that has to date proved that there is something called as a leaky gut. We are hoping that our hypothesis fits into it because we're being able to treat the result of it. But it is specific diseases that are giving the problem, and I don't think it is fair for for the industry to be hyping this leaky gut for either the sale of probiotics or the sale of antibiotics or whatever it is. I think it's just not right. That's my myth for the day. Thank you, Rajashree.
After all that she said, Dr. Amol, what would you like to add from your end?
Yeah, yeah. So basically, what I would say that have small frequent meals. You should have frequent meals. You should give time during eating. That prevents aerophagia, reduces bloating. Most of the patients eat very fast. Take adequate fiber in the diet. Have cooked vegetables. Have one fruit a day, preferably one fruit a day. Any colored fruit you can have. Okay, avoid over-the-counter medications. Popping antibiotics or anything,
Yes.
any painkillers, routinely painkillers they use for headache, and have a good hydration. Have good hydration. Yeah, that's a and any if any warning signs are there, like any nausea or any sudden weight loss or any unexplained anemia, then please consult your gastroenterologist or any physician. Any physician also you can consult and get it treated,
I think the
get it investigated.
the inputs you both have shared are so significant, and even if we decide to fall to start aligning to all these from tomorrow, from the World Health Day itself, including myself, I think so much can actually improve in our lives. But having said that, Dr. Kirkar, what are your takeaways?
My takeaways are listen straight at whatever capacity that you have, proper warm up, proper cool down, and proper nutrition, good sleep.
Great. And Dr. Bansal, your inputs?
Uh, so most important thing that I feel that we haven't discussed is something on a sleep discipline. Okay, sleep discipline means that what we are as a generation completely uh, disregarding. The bed is meant for sleep, not for watching movies, not for scrolling at night. Basic essence of sleep discipline is as soon as you lie down on bed, you're conditioned to go to sleep. Okay, so that would pretty much take care of something known as headache. Almost 60 to 70% of headaches are as a have as a contributing factor poor sleep discipline. So just fix this part. Most of us get much better. Okay. Of course, everybody else has covered the rest of the things.
Yep.
The myth that I want to really address is that deadlifts are not bad for your back. Dr. Kelkar has also mentioned that you should do resistance training and you should lift weights. Lifting weights will probably give your joints a better health than not lifting weights. And that is acceptable at any age, whether young or old.
Also, through menopause, is it advisable?
It is advisable at every stage of life. You can change the pattern of resistance. For
Yes.
people who are undergoing joint strains, we advise that instead of lifting a direct weight, you use something like a resistance band that provides the maximum resistance at maximum peak of contraction when the muscle is more stable. And as you release the muscle force, it starts releasing the stress on the joint. But definitely, resistance training, sleep discipline, that's it.
So when you spoke about initially in your talk about benches being on the same bench,
Yeah.
and Dr. Kirkar spoke about having an everyday routine. It took me back to our school days, and can't but mention our school, which we both belong to, the Singhania school, and so I think all of these habits really need to start from our school days, and in fact, nutrition should be part of our curriculum itself. So I think and all these, not just nutrition but all the lifestyle and especially the physical activity in a very scientific way needs to be incorporated from very early on in our lives, I think. And it was a brilliant session with all of you, and I'm going to close the session now for today with a promise that we will have all of you again with more inputs and insights. I hope you all had fun yourselves having participated in this session. And as we conclude today's discussion, one thing is very clear, that health is not the responsibility of one specialty, one solution, or one approach. It is a result of multiple disciplines coming together intelligently and scientifically. What we've heard today reinforces a powerful truth. The future of healthcare lies in integration, personalization, and prevention. At Truwellth, I would like to emphasize one more time, our mission is to integrate all appropriate scientific evidence-based medical and advanced surgical treatments, nutrition, fitness, and lifestyle interventions to not just manage, but to transform health outcomes. So, any of you would like to reach out to any of these experts, please feel free to reach out to us, and we will connect you with them without absolutely any hesitance and resistance. And because informed health decisions should never be driven by trends, but should be driven by evidence and experiences, what we firmly believe in. And as we move forward, let's remember, health is not something we fix when it breaks. It is something we build, protect, and optimize every single day. Thank you to you all, to our esteemed experts, of course, for their valuable insights, and to our audience who is always is a part of our journey since many years towards your best health. And once again, wishing you all, especially our viewers on True Wealth, we wish you holistic health and happiness on the eve of World Health Day.